Richard, what does it mean to improve the brain function of my ADHD child at the deepest level? What does that even mean? I don't even know what the deepest level means, and I don't even know what to improve the brain function of my child means. Does it mean they're going to get better grades? What does this mean?
You know, it's funny. I do a lot of thinking about this because we view the brain as being so vastly different than the rest of our body. You know, it's like mind, body, and it's not mind. It's all body, right? We have so much information about how to improve our muscles and our quickness. And if you just look at history, like, you know, in the 1920s, if you were running down the street, people would ask what's wrong with you, or maybe you stole a wallet or something. But in the 1980s and moving forward, everyone would be like, oh, well, that person's getting in shape. And I think we're kind of in the 1920s for our brain, right? It's like, well, why would you do that? What's wrong with you? Like, it's the mental health, you know, stigma and all this stuff. Where the reality is, would we show up to a professional basketball competition and just be like, well, I'm not going to work out. Why would I strengthen my body or like practice? And like, I should just be able to show up and play. And that's what we do, especially with our kids, like throw them in the classroom and, you know, they're supposed to just naturally do the thing. What do you mean there's a weakness? They can't, that would mean there's something wrong with them. No, it just means they have this relative weakness. Well, can you do something about that? Yeah, you can do something about that. What would you do? Well, think about the muscle. What do you do? Or cardio, like you put yourself in a place where you are just kind of strenuously pushing beyond the limits to grow that thing. Is it your biceps? Is it your, you know, jumping, whatever it is? So what if you could do that with the brain? Well, you can, and there's a ton of methods to do that. How do you do that? You see an expert that can isolate that area, that can push your child beyond their limits, and it grows just like a muscle grows. But the cool thing about the brain is that it doesn't atrophy, like if you don't use it, unless you're in a dark, isolated room, which hopefully none of us are, but you could be in a dark, isolated room. You could literally atrophy your brain, but the thing is, our children are not in those situations. If you increase the function of their brain, and then you throw them back in, you know, playing with other kids or going to the classroom or whatever it is, like it grows even better. In fact, when we follow up and we haven't done anything, you know, maybe a year later, they look even better because their brain, it's like you added Miracle Grow and their brain is like, take it off. Of course it would, because you help them improve that weakness. And it's pretty amazing. And so it's like people are, what do you mean neuroplasticity? Neuroplasticity has been around since the early 1900s. It's not a new concept, but there's new technology to make that exponentially better. So why wouldn't we do that?
So what's the new technology? How do you improve the brain function at the deepest level? What does that mean to improve it at the deepest level? What is there, like 10 levels and this is the deepest one, or what's the deepest level?
Well, so I started this whole, you know, exercising the brain. Like most people think about, well, how do you improve attention? Well, maybe you do the surface part of it is, well, you pay attention more. Great. But what if there's something, you know, that is preventing that deeper in the level of the neuron, right? So there's really, if you take a tiered approach, you're in the classroom, I'm not paying attention. Okay, you do a neuropsychological assessment. Okay, I can see people can't, whatever it is, sustain their attention, divide their attention, right? Switch their attention. Well, you know, there's a thing. Well, you can do that thing and push them. But if there's something going on at the brain level of the brain, then you got to go deeper. What do I mean by that? What are the neurons doing? What are the axons? Like, how well developed is that particular network? Well, you can actually look at that. Through modern technology, you can break the brain down into 23,000 parts. Like, I can send you literally equipment to look at this stuff in your home, and I can show you. We don't have to guess. We used to call this a black box in the 1950s. What's going on in there? Who knows? But now with modern technology and imaging, I can look at the activity of your child's brain and show that to you so there's no guesswork, and isolate that area and improve the neuronal functioning. The neurons get better. They do more of what they're supposed to do. And it's like, you know, think of a mailroom. What's going on inside the mailroom? Are they sending packages to LA or New York? Like, for that particular network, you can actually train them to do that. And then it's permanent because with neuroplasticity, that's just how it works. You myelinate your brain, you maturate your brain, and it's permanent. And now the child can, like, if they want to focus, they can do that. And now nobody has to yell at them because they can actually sit at home and actually do what they're supposed to be doing and be themselves. It's pretty amazing.
So that's the reason why we want to do this, is because the child can focus whenever they want, because they've had their brain worked on and built and practice being built physically in ways that allow them, their muscle, to have grown in this way.
Right. Yep. They just like, and their brain's going to mature anyway. But the problem is stagnated. It hasn't kept pace with the development of their same age peers or the development of their own natural skills and abilities. Like, come on, like, everyone's not going to, like, the abnormal state of the brain would be like everything is matured at its optimal level. Like, nobody has that. Nobody's like the best football player, the best ballerina, the best musician, the best scientist. But you could be. And the reason why that happens is your brain starts to prune out the things you're not using.
Why doesn't everybody do this? What's the reason people aren't doing this?
It's, I think it's the medicalization of our society and the brainwashing of our society. One, there's a big stigma on mental health. Two, it's like, what's the thing you have? Let's identify the thing. Okay, well, now I got a thing, and I got to feel bad about that thing, and I got to get accommodations, and woe is me, and maybe I got to take some thing to make me feel better. And that's actually not true. If you can just get over that, and you can be like, all right, let me accept that I have a true weakness. And why couldn't we do that in the past? Because there was nothing you can do about it, right? Zero. But if there's like, is something as simple as like, do you take the blue pill or the red pill? If you take the blue pill, you're going to get better. You probably take the blue pill. You do that for your child so they could like control their brain and get better. But you don't have to take a pill. You can be like Dorothy from The Wizard of Oz, click your heels and say, this is what you do, little Susie or Johnny. Let me have you meet with a coach and exercise your brain so you can actually make that exponentially better. But people don't do it because they don't know about it, or they've been deterred by like the experts who have like, and I used to be one of them. Well, that doesn't work because of, the research says it doesn't work. I didn't look at the research. I listened to the people that I trained with. I can tell you right now, I could call Stanford up right now, where I used to work, and talk to an average psychiatrist or psychologist that works there and be, hey, what about this whole brain training thing? And they would give me an opinion based on zero experience and maybe reading one or two articles, or maybe their mentor, and it's not their fault, right? Like, that's what I did. But I'll tell you on another video, like, what I learned. But you gotta have experience with it. You gotta look at it, because people are suffering, and people, if something works, deserve the opportunity to get better. So we've worked with thousands of people and helped them get better. It's just the state of the way things are. People just don't know about this, and they really should know, because it changes people's lives.
I understand all this now. What should I do first to improve the brain function of my ADHD child to the deepest level? What do I need to do?
You got to find an expert that is not like cutting costs, but they're doing the state-of-the-art brain mapping and brain training. Not like one or two sensors, 19 sensors. How do you know what they're doing? They put a full cap on your head to do the brain map, and they leave that cap on to do the training. If they're not doing that, they're not doing state-of-the-art training. And there's a whole like controversy about this, but I'm here, like, I have no investment in one thing or another, because I've done it all. I know exactly what works. That's the most powerful way to train the child's brain. And so find an expert. Some people, we provide these things in people's homes. Some, depending on where you are, you might have to travel into a clinic. Sometimes that's impossible because it takes a couple hours depending on where you live. But yeah, you got to find an expert that knows, like, somebody who's an expert in the brain, not somebody who like went to a weekend seminar and the brain's a pretty fragile, special thing. It like drives the entire quality of your life. You probably, I always say you don't go to 7-Eleven for sushi. Like you could, but that's not where I'm getting my sushi, right? I'm going to a brain doctor for brain treatments. You know, I'm going to go to the top restaurant to get my sushi, right? That, I mean, maybe, you know, and I probably wouldn't get one of those hot dogs either. But if I were, I would go get a hot dog there.